Okay. Hi, everyone. This is Marisa from Give Asia. Mom, this is Mommy Jane. Hi, Mommy Jane. And this is
Yeah,
Katniss. Hi, Katniss.
Katniss. Say hello.
Hello, Katniss. Yeah, Mommy, can you give us a short background of Katniss' condition?
Oh, Katniss was actually diagnosed with Ewing sarcoma. Uh, we started actually observing this condition when she complained for pain in her right thigh. Usually,
Mm-hmm.
it actually started last year, 2021, but the pain is not very prolonged. Like for example, it would only take a day or two. So the first recorded case we have had was last year 2021, and then after that first incident, it happened again in February. So it's not actually by month. Usually it happens once in a while, like then after a few months it goes back again. But the very significant, significant observation that we have had with Katniss was on August 15, when she complained of pain again. This time, uh, she told me it's very painful already compared to the previous ones. And then uh, her thigh actually swelled. It's actually swollen, and we were worried because she has no bruises and there's no wound also. So we thought, how come there's a swollen area here on the right side, but there's nothing, like nothing happened, like no bruises, no pain, no
Yeah.
wound. No wound. Yeah. So we we rushed on to the hospital, not on 16 already, because we were still observing. Maybe there's a bite, that's why it's swollen. But the next day, it did not go away. So we went to the doctor, and the doctor told us, because he is a pedia doctor. So after asking for the X-ray, and then he really told us that we should seek medical services to either Cagayan or Cebu,
Mm-hmm.
because and he also told us specifically you should see an oncologist.
Mm-hmm.
So when he told us that one, we were really worried. Yeah, because oncologist, that's meaning it's cancer. Yeah, I thought it's only ortho, for the bones. Yeah, because in the X-ray, yeah, her bones were really like eroded. They become fibrous.
Mm-hmm.
So uh the doctor said we have to seek for, a second opinion, or we have to go to Cebu or Cagayan. And then when we asked we searched for possible doctors. We asked our colleagues, our friends, and they told us that in Cagayan it's only for adults, no pedia.
Mm-hmm.
Okay, so we opted to go to Cebu. So on August 18 we went to Cebu. Yeah, so we come here because we're in Cebu right now. We come here to Cebu, and then uh the doctor that was referred to us was Dr. Hulaisan, but the it was actually not the pedia doctor that we went to, for Katniss. It was actually referred by my colleague,
Mm-hmm.
yeah, who has a friend in Cebu, and his and her friend suggested that it should be Dr. Holaisan, because Dr. Holaisan is actually known here for treating cancer
Mm-hmm.
patients, pedia. So we went to Cebu here, and on August 18 we talked with her doctor, Dr. Holaisan, and then after that one, she asked for MRI with contrast. Yes. So to check what's going on, because she only saw the X-ray result.
Mm-hmm.
So she wants a more detailed one. So she asked for an MRI result with contrast. So at that time we were scheduled on Friday, but we did not know that MRI result would take so long. It would take
Mm-hmm.
almost an hour with contrast. So we went to the MRI room, but we were unsuccessful because Katniss cried.
Mm-hmm. Of
So
course.
yeah, so her thigh keeps on moving. So
Mm-hmm.
the next day we had another schedule, and she was sedated. Yes, she was sedated, so it went well because she was sedated, so no movement at all. And then after 3 days, so the result came out, and on August 23, when we already got the result, it was stated in there. Malignancy is a primary consideration, and it could be Ewing sarcoma or lymphoma. Okay, so that's why our doctor referred to us to a surgeon in just in case if we opt to have, I mean, if it's Ewing sarcoma, usually it's going to be amputated.
Mhm, mhm,
Yes, but or if it's possible for the tumor to be taken out from her thigh. So we went to Doctor Astrologo for his impression or for his idea on what we're going to do, and he told us the only way to take the as a surgeon for him, the only way to take the tumor is by surgery, and that is amputation, really. And we said, no, we don't want our child to be amputated because she's still very young and she's a girl. So and he referred to us to Dr. Miguel Go again, no, another doctor for bones, specialized in bones, because he told. But for me, you can ask Dr. Miguel Go if it is really possible, because he is expert in it comes to bones. And so we went there, and then Dr. McGilgo also said, "Oh, as of this moment, based on the case of your child's right thigh, we have no other way but to amputate it, really." So we went back to Dr. Holaisan. Dr. Holaisan told us, "Okay, mommy," and she told me, "Mommy, okay, if you don't want your child to be amputated, okay, maybe we can try chemotherapy for your child so that the tumor would actually loosen. I mean, it would decrease in size."
mhm, mhm,
And then if after the 5 cycles the tumor would decrease, then we will reevaluate it. Yeah,
mhm,
we will reevaluate it whether radiation would work, or if it's responding well to chemotherapy, we will proceed with the cycles, or if it's possible for the tumor to be done taken out by a surgery, then they would decide after five chemo cycles. And we're still on our fourth right now, and hopeful, and so far we have noticed really a change. I mean, it's
mhm,
really a positive change, because the swelling is now decreasing. Yeah,
mhm.
though, though we would still feel like it's hard on the right side compared to the left side. We told the doctor if it's possible, because uh she can already walk a little now, unlike before that she cannot really walk. Yes, she only lies down, and she can't even sleep at night.
Mhm,
Yeah,
mhm.
it's really painful. uh, in fact, she told us to have the pain reliever while waiting for the biopsy result. At that time, she would say every 8 hours, or as needed. But even after 4 hours, it's already very painful for her. Yeah, so we have to give the medicine to her, and she would vomit sometimes because it's tramadol.
Ah, okay.
So yeah, and she would say she's always dizzy. So the doctor, if I asked the doctor if there's a possible, another option that the pain would be relieved, she told me that's the only possible way for now. We have to endure while waiting for the result. And when the biopsy actually came out, so that's a time. So we got the biopsy last September 9. And then she told us that this should be, the chemotherapy should start as soon as possible. But at that time, we did not have funds yet, man. So we look for sources. Yes. Uh, so we actually got a loan, yeah, for her first chemotherapy. So on September 19, she had her first chemotherapy already. And then so since we are in Cebu, so we left work, and so we asked our doctor if it's possible that we can go back to Uzamis, because we are from Uzamis. So if we could go back to Uzamis, and then we'll just come back here when when it's already time for her chemotherapy, because according to the schedule it should be every 3 weeks.
Mm.
She
Okay.
will receive the treatment
Therapy.
every 3 weeks. And the doctor told us, you're not allowed to travel, mommy, because it's very risky for infection, and Uzamis is very far. Yes. Uh, and she told us that even if you ride a private vehicle, for example, in according to what she said, she had cases before, they actually rode a private vehicle, but they still got an infection. How much more that we're going to travel? Uh, we are going to travel via ship,
Mm-hmm.
so there would be a lot of people. Yes.
Mm-hmm.
And she even shared to us that she had a first case of Ewing sarcoma already before. The patient got better, but the parent traveled it, so they rode a ship also. And when the patient came back to Cebu, the patient was already in ICU.
Oh, okay.
So
Because of infection.
because of infection, so the
So
patient
it's too
actually,
risky.
yeah, it's too risky. So we applied for 2 months leave with my husband. Yes, because 2 months leave with my husband, and then we felt that if all of us are not working, so how could we raise funds? We cannot anymore apply for loan because both of us are not working. So we planned that he will go back to work, and I will stay here in Cebu with my daughter.
Okay.
Yes. So that's what happened. So I'm staying here with my daughter in Cebu while he is back in Osamis, because he has to take care also of our other child, our second child, because he has she has a brother. Yes, and
Okay.
he's still 4 years old. Okay,
Okay. So
so
right now your family is separated.
yes, our
Mm.
family is separated.
Okay. Understand. Thank you so much, Mommy, for sharing all of those with us. So givers, there you have it. Actually, Mommy already told us the whole story and how their family is really struggling to, overcome this challenge in their life. So, dear givers, if this family has knocked into your hearts, please consider to help them so that Katniss would not have her leg amputated. Hopefully, the chemo will work, and then mommy and
Yes.
daddy can continue with the chemotherapy till you finish the chemotherapy and let Katniss live a normal life. So, mommy, we
Ye-
wish you all the best. Thank you so much for sharing your story with us, and we hope that everything would go well for you and your family.
Thank
Okay.
you so much, ma'am.
A little message na lang po, ma'am, para sa mga magbibigay. Short message lang po.
Okay. So thank you so much for I would say advance thank you for helping my daughter, because she really means a lot to us, and we want her to have a healthy life, and we want her in our lives, like until she grows old, because she really is, I mean, we really were shocked when she got this kind of disease, because this condition, because she's a very sweet girl, like a very cheerful one, and also we really think that she's really smart, because at an early age she can do, I mean, activities that are beyond like academically, because at the age of 6 she can now already add, subtract, divide, and multiply, and she can read stories already and can understand them. Yes, she's really, we believe that she's really a fast learner, and we feel so sad that she has this condition and that would stop her from going to school. That's why when we are at home, she would say, "I want to go to school, mama," and then I would say, "Oh, we can have a pretend school."
Mm.
Yes. So I wish that you would help my child um, overcome this one. That would really uh, be very very helpful for her and for us, her parents. Thank you so much.
Okay. Thank you, mommy. We take care.
Take care. Thank you.